Today we're going over the 3 most common causes of sciatica. When I have a patient in front of me and they're complaining of back pain and leg pain and I think they have sciatica, these are the things that we start going over so we can figure out where your pain is most likely coming from and exactly what you should be doing to help you recover faster. Sciatica can be one of the most stubborn things to treat. It can be really hard to put your finger on exactly what's causing your discomfort, but we're going to try to do our best today. With the second thing that I'm going over with you, I promise you, you most likely haven't heard of this before, and so just hang with me. We're going to go over that, but we're going to go over the 3 most common causes to help you figure out what's going on and what to do to make it feel better. So let's go over one of the most common culprits to cause sciatica, and that would be a disc herniation. Disc herniations can be way more common than we think, and a lot of people have them and don't even have symptoms. And if you know you have a disc herniation, it's because you've had an MRI to tell you so. So here are the typical stages of a disc herniation and how the disc may end up pressing on the nerve. Over time, or from a past injury, or even a recent injury, the disc and the structure that it lives in starts to lose resiliency and begins to push onto sensitive structures in your lower back, such as the nerves. And that causes an inflammatory process, making the area irritable to movement and just painful all the time. It's one of the most well-known causes of sciatica, and it happens when that disc is just pressing on the nerve roots that make up the sciatic nerve. And so it's multiple levels in your back or one level in your back, and it's typically one-sided, but that nerve gets really irritated and starts to cause you symptoms in your glute, leg, or calf that can be pain and numbness and tingling. So the 5 things that I typically look for if I'm like, okay, does this patient or person in front of me have sciatica caused from a disc herniation? Well, 1, you're usually 40 years old or younger. It typically happens in younger folks. 2, you have very difficult time bending over and sitting. And so if you notice that trying to bend over and pick up something from the ground or rounding your back causes your discomfort, that's making me lean more towards a disc herniation as well. You may have pain down the leg, and you may have numbness and tingling into the leg or foot, and then oftentimes that pain is always sticking around. It's kind of lingering, it can ebb and flow, it can feel a little bit better with movement, but it's kind of always there and it's very uncomfortable, which can cause you to walk differently and do many things in your day very differently. So if you felt like you were kind of checking those boxes and you had most of those difficulties or signs and symptoms, then your pain may be coming from a disc herniation. There's a few things that I would recommend if you feel like that's you. 1, really try not to sit for a long period of time. Try to stay up and moving. I know that's challenging if you're trying to sleep or if you just need to rest, but movement kind of moves some of that inflammatory soup around the nerve, that stuff that's causing you discomfort. It kind of flushes it out of the spine, which can give you relief. The other thing that I would do is perform gentle nerve glides and core strengthening. And I go over both of those things in my free sciatica PDF that I'll put in the description. If you download that PDF, it'll have a little bit more detail in those things. But I want to go over with you, the one exercise that I typically give folks when they have a disc herniation to help reduce some of the inflammation around the nerve. So this is what I give my patients who have a disc herniation, is that we want to remove some of that inflammatory soup that's sitting around the nerve. And we're going to do that using movement, but we're going to use this strap, and we're going to use a strap that is not stretchy, that it has some good tension in it, because we can't have it bend. You're going to put that loop around your foot and lie down. If you don't have this strap, I'll put a link to it in the description. So you're going to lie down, you're going to have that leg straight, okay? You're going to relax your arms and your legs and get ready to pull up, keeping that leg super relaxed, create tension in the calf and hamstring, and come back down. Remember, motion is lotion for that nerve, and so we're going to do 20 to 30 reps of kind of just tugging that nerve and moving that inflammatory soup away from the nerve roots in your lower back that's causing your discomfort. Is this putting the herniation back in place? No. That happens over time and through this type of thing and with core strengthening, but what we are doing is helping you feel better in the moment and by reducing the inflammation around the nerve. So 20, 30 reps, keeping the legs super relaxed, pulling up and down. Now, it is completely normal to have to rest. It is also completely normal to have some numbness and tingling when you do this. Just do your 20 to 30 reps and rest, and we're gonna do 2 sets there, and we're gonna go up and down. And what this is doing is removing some of that inflammatory soup around the nerve. Yes, you could do both legs completely fine. I would recommend doing this at least once a day, but it could be really beneficial of doing it right in the morning when you wake up, because sometimes we could feel really stiff and uncomfortable in the mornings. And so when I have a patient with the disc herniation, I'm gonna be doing things that I showed you or talked about in that sciatica PDF that you can download, but also the nerve glides and then gentle core strengthening over time. If you're not getting better, make sure you reach out to a physio or somebody that can keep track of your physical health and help you just nudge that nerve and improve that disc herniation a little bit faster and a little bit more effectively. So this one is often overlooked, and it is adverse neural dynamics. That is the second most common cause that I see of sciatica and sciatica-related symptoms. And what that means is adverse, which means not right, neural means nerve, and dynamics means movement. And that how the nerve is moving, either where it starts or along its pathway, isn't moving into its full potential. It's not moving very well. And this is often overlooked because it's in people that have had a back injury acutely, which is more recent, or for a long time, and it's not really explained. They can't put their finger on the cause. They know it's in their back, and sometimes it can be radiating down the leg. One thing that I often see is that people report back pain and like weird calf stuff, or they have no back pain and just have weird calf things that isn't getting better with calf stretching. Same thing for the hamstring. You know, they have these lingering hamstring things, but it's just not getting better over time. And what people often miss is adverse neural dynamics. And what that means is the nerve, its environment that it lives, it's just not moving very well, giving you these lingering symptoms in the glute, hamstring, and calf, or even the foot. And so people, they really have, you know, an eye-opening moment when we go over the testing for this, because they're like, wow, like that was different, and that was exactly what I'm experiencing. And a lot of my folks who have pain down the leg have adverse neural dynamics. And so I want to go over this with you and help you test it and treat it. So the most common signs that I see related to adverse neural dynamics is really stiff in the morning, really stiff and achy when you've been sitting for a long period of time. You typically feel better with movement, and you have unbelievably tight hamstrings and difficulty bending forward, and you're kind of the person that's always said, I haven't been able to touch my toes my entire life. These are the people that have adverse neural dynamics. And so I want to go over with you what that feels like when you have it and how to treat it. Okay, so this one's it. This is what's really going to make a difference if you're having that leg pain or stiffness down the leg related to sciatica. So what you're going to do is you're going to stand next to something sturdy. I'm going to use this rack here, and you're going to have a chair in front of you. You're going to stick that leg that you feel really tight, and if it's both, we'll just do one at a time. You're going to put that leg right on top of the bench. You're going to stand really tall. Now, I always like to hold on to something because it's not worth losing my balance over. So you're going to stand up tall. You're going to pull those toes back, not as far as they can go, but just a little bit of tension. And then you're going to bend forward. And for me, I light up right away. I feel this in my back and all the way down my leg at the same time. Now remember, adverse neural dynamics means the nerve is not moving well, and this is what we're going to use to force it to move well. If you've always felt tight or having those lingering symptoms down the leg and you don't really know why, this is going to be a game changer for you. So I'm kind of turning my body into my leg. For this example, I'm using my left leg. I'm going to turn my right shoulder towards my left leg. I'm going to round out and come back up. Round out and come back up. And I'm just stopping when I feel tension in the leg. And actually my foot's starting to tingle a little bit. And that's normal, right? Because we're pulling on the nerve and we're forcing it to feel better. We're going to go down with a little bit of that toe pulled back and come back up. Now this is just a level 1 stretch of this. This is what I have my people start with. And so just listen to your body, force it into that range of motion and go down. And what you will notice is that you may have some of your symptoms and some of your tightness. That's good because you want to search for that and to kind of what I say, flirt with it, because you want to say hi to it, not push too far, but definitely go up to that barrier. And you're going to go down and come back up, down and come back up. And so it's going to feel a little different than a traditional hamstring stretch. But what you're going to feel is you're like, wow, like this feels completely different than anything I've done before. This leg is completely relaxed. I'm balancing on this leg. I'm holding on. I'm moving forward. And since we're trying to improve the movement of the nerve, we're going to move a little bit more ourselves. And so that's gonna be 20 to 30 reps and come back up. Now, if it starts to tingle, like mine is, I'm just gonna shake it out. It should go away pretty quickly. Now, after I do one side, I almost always do the other side. I round out and come back up, and I round out and come back up. And to feel a little bit more intense stretch, you just pull your toes back a little bit more, right? Oh, now guys, if you have any questions, put that underneath the video because it's worth going over the nuances, but it's a little bit different for everybody. Oh, leg straight, bend over, pull the toes back just slightly, and then and enjoy that good feel. Now my patients end up loving this and hating this at the same time because it hurts so good. But do yourself a favor, is after you do that stretch, 20 to 30 repetitions on each side for about a 1 to 2 second hold, go ahead and try to bend over and see how you feel. Go ahead and take a few steps and see how you feel. And 99% of the time, if you have adverse neural dynamics going on, my patients, man, do they look good after they do this stretch. They're walking better, they're feeling better, they can bend over more. And what's great about this is it's not a strengthening exercise, so you can do it multiple times a day, in the morning, in the afternoon, and the evening. It could be a game changer in how you feel, and if you keep up with it, it's going to get better and better, and that you're going to regain some of that range of motion. So I hope you guys found a little bit useful. And if you have adverse neural dynamics, that's really going to be impactful for you. Stay consistent with it. Go into your limitations, but enjoy it. Now we've went over disc herniations causing sciatica, adverse neural dynamics related to sciatica, and now we're gonna go over the very last thing and one of the most common causes of sciatica. So this is the third most common cause of sciatica, and it's called stenosis. And at its definition, stenosis is a space issue, and that in your lower back, either in the center, which is called central, or on the side, which is called lateral, you start to have some bone growth, most often caused from arthritis or age-related changes such as degeneration. And that bone growth is pressing on the nerve. It's pressing on the structures that are sensitive to things that are really hard. And so bone is really hard. And when you start pushing or start having bone that's pushing on the nerve, it's gonna cause you some symptoms. And so sciatica related to stenosis typically is in those who are over 60 years old. And those people typically have a very difficult time walking, very difficult time arching backwards or reaching overhead. I even had a patient tell me once that every time that they changed a light bulb, that they had pain down their leg. The extension of their back or arching backwards is what's really uncomfortable because extension closes down on the space just naturally. And when you have extra bone there, you have less space and less forgiveness in the spine. And that can cause you pain either in one side from the lateral stenosis or both sides central stenosis, which is less common. And so if you find yourself a little bit older, you find yourself nearly pain-free when you sit, but when you stand and walk and you arch back, you have a lot of symptoms or pain down one leg and a lot of sharpness in their back, that can be related to stenosis. Remember, stenosis is a space-related issue. And so if you feel like you have stenosis, the way that we improve that is through flexion-based exercises. And so flexion, which is the rounding, the sitting, the bending forward, that's typically and nearly always pain-free. We use flexion to help reduce pain and improve movement and strength in the spine. I go over some of those things in my sciatica PDF that I mentioned earlier, so make sure to grab that if you want some more details on specific exercise. But I'm going to show you what I typically do with patients when we're trying to use flexion to reduce pain and improve just their longevity and improve their symptom management over time. So here's the 3 things that I tell my patients when they have sciatica related to stenosis. 1, you don't do yourself a favor by trying to push through the pain and stand and walk longer when you have the pain. When you have the pain, in this particular condition, it is not the old mantra of no pain, no gain. Actually, you can irritate the nerve and structures more if you try to push through it. So if you're standing and walking and begin to have discomfort, then sit down. Use flexion as your friend. Don't push past it. There's nothing to gain from that. The other thing, use flexion as your friend. Like I just said, you're going to use flexion-based exercises to help give you relief. And then 3, just sit when you need to, okay? Listen to your body, sit and just take pressure off that nerve, because sitting is like a decompression technique of the back of the spine, the areas where you're having the stenosis. So sit because it can give you relief. Now, I'm not saying sit and have a sedentary lifestyle, but this is what I do with my patients, is that we want to improve, they typically want to improve how long they can walk and stand before they have discomfort. And so what we do is, okay, we're gonna start a walking program. We're gonna walk for, let's say, 1 minute. If you have symptoms, you're gonna sit down. You're gonna wait for those symptoms to go away, and then you're gonna stand up and walk again for another minute, sit down, stand up and walk again, and you guys get the pattern here. So you're not gonna give up on it. You're just going to listen to your body. And what I see in my patients is that when we use flexion and sitting as our friend to help improve pain and discomfort, that time that you can walk improves over time. So maybe week 1, you can only walk a minute, but maybe week 2 or 3, you start to notice 1:30, 2 minutes before you start having pain and leg symptoms. And so using that walking program consistently and over time will help you improve. Now, if you have a hard time doing it on your own, just team up with a physio or PT. They can walk you through that walking program that's gonna help improve sciatica related symptoms. The other thing I have my patients do is do seated exercises, right? So you could do a piriformis stretch to reduce your discomfort. Bend over, cross that leg, feel the glute stretch. You could do a seated lumbar flexion stretch. You can bend over and do that. You could start to do some squats from this position. Do a couple sets of 12, because you don't have to stand up all the way tall. You can just go up and down. And so you can still improve your hip and lower back strength when you have sciatica related to stenosis. And even though that space is closing down and difficulty standing and walking and arching backwards, those things can absolutely be happening. The tolerance of movement and extension that the nerve has can improve with exercise. We've seen it time and time again, and that's why conservative treatment comes out on top when you're trying to treat sciatica related to stenosis. And so we went over disc herniations, we went over adverse neural dynamics, and we went over stenosis related to sciatica. And those are the 3 most common causes that I see that people can suffer from that would be causing their sciatica. So I hope one of those things resonated with you guys today, and you're like, hey, I feel like my symptoms are more likely related to adverse neural dynamics. Then use those tips and tricks that I showed you in this video related to each of those diagnoses to help you start your recovery process. Listen to your body, use those tips and tricks, figure out what you feel like you have going on, and download that free PDF. There's nothing to lose there. Just download that PDF, and it'll give you some more details to what I use and tell my patients when we're treating sciatica that's related to those things. And so I hope you guys got something from this video. I had a ton of fun explaining those things to you, and I know you're gonna get some value. So figure out which one you have and start that recovery process today. But as always, guys, stay healthy, keep moving, and take care of yourself.